Uttar Pradesh government has told the Legislative Council that there were no deaths due to the lack of medical oxygen that were reported in the state of Uttar Pradesh during the second wave of the COVID pandemic. This is a claim that has been rejected by the opposition. The government has said that death certificates make no mention of death due to lack of oxygen in any of the documented 22,915 patients who have died due to COVID-19 during the pandemic. The minister said that there were several deaths during the pandemic. They were due to other diseases, including terminal diseases, and that no deaths have been attributed to the shortage of medical oxygen. Alok Pandey joins us with the very latest. Alok, Uttar Pradesh government, they're clarifying that there were no deaths due to the lack of oxygen. Your own ground reports during the time will show otherwise.
Well, yes, you are absolutely right. So what happened was that the question hour was going on, like the question hour in Parliament. You also have the question hour here when the Assembly is in session. So the Assembly was in session, and there was a question hour that was going on. So a Congress member MLC, had basically raised a question about how many deaths due to a lack of oxygen happened during the pandemic. To which the Health Minister Jai Pratap Singh, he basically said that no death has been reported in the state due to lack of oxygen during the second wave of the COVID pandemic. So a supplementary question was then raised where the Congress MLC asked why the government did not have details on these cases when it had been flagged. These deaths have been flagged by its own ministers and MLAs. So he was basically referring to the time during the second wave of the COVID pandemic when a lot of people within the BJP were writing letters and saying that there was an absolute lack of infrastructure and lack of oxygen during the COVID pandemic. So the minister then rose again in the House to say that we are getting our information from the death certificate that is issued when a hospitalized patient dies. And he said that in these death certificates, there was no mention of death due to lack of oxygen in any of the 23,000 odd deaths that took place during the second wave of the COVID pandemic in Uttar Pradesh. So again, this is very technical, and that is what the minister referred to when he said that when I say that there was no death due to lack of oxygen in the state, this is what I mean, that a death certificate does not say it, and that is why there are no deaths. Now, apart from the fact that, like you said, a lot of our ground reports had shown the abysmal state of infrastructure when the second wave of the pandemic was on, and how there was this terrible shortage of oxygen. It does also appear a little insensitive because at the end of the day, you have these families who lost their loved ones, many of them standing in queues for hours outside oxygen plants, begging officials to arrange for some oxygen, and that was not done, or that could not be done. And yet this technicality being cited time and again, this is not the first time. Obviously, as you and I were just discussing before we went live, that the UP reiterating is a big thing. But if you remember in Parliament also, I think in July, the minister there had said that states had not given any data to say that anyone in this country had died due to a lack of oxygen. Again, the same technicality that it's not written in the death certificate. So at the end of the day, something that will be, again, if somebody who's lost his loved ones will watch this, they will perhaps wonder what is going on. But this is what the UP government said today on record in the Legislative Council.
Well, the Uttar Pradesh government has said this on record, but like we've been talking, Alok, your own ground reports during the second wave of the pandemic from Uttar Pradesh, and that story that's really hard to forget in Agra when patients died at the Paras hospital because the district magistrate stopped that oxygen supply temporarily. It was a huge controversy. Despite several of these cases, several patients' families on record talking about oxygen shortage, the government has officially in the Uttar Pradesh Assembly denied, in the Legislative Council denied that there was any death due to oxygen shortage. They've of course said that the cause of death has not been cited as oxygen shortage in the death certificates, and it's that technicality that they are essentially holding on to. Alok?
Yes, you are absolutely right. They are holding on to the technicality of saying that look, if it does not say so in the death certificate, then it's not there. So that is the technicality that he has held on to, the minister, when he's replied in the Legislative Council. But again, just to point out that Uttar Pradesh may not be the only state who said this. There are successive state governments who've been saying this. by citing the same technicality, I think it may be at the end of the day a disservice to the memory of those who died and the families of those who died, who still perhaps will not be able to come to terms with the kind of deaths that many of their loved ones had to face, or the kind of hardship they had to face in arranging oxygen, something so essential for their loved ones.
Well, absolutely. And, also very important to highlight here that an acknowledgement of the lack of medical oxygen or a shortage of medical oxygen leading to deaths, not just in Uttar Pradesh, but this was a pan-India story that was playing out. An acknowledgement of these numbers or an idea of these numbers will really help the government and the authorities to plan for future waves of the COVID pandemic. God forbid if the situation is to be as bad as it was during the second wave. However, the government has said this on the floor of the House, the Uttar Pradesh government reiterating to the Legislative Council that there were no deaths that were reported due to the shortage of medical oxygen. Thanks, Alok, for joining us with that update.